We begin today with the latest on the coronavirus pandemic and a new roadblock in getting America vaccinated. Several people in Georgia suffered adverse reactions to the Johnson & Johnson vaccine shot. The state temporarily shut down a vaccination site. Patients in North Carolina and Colorado also reported side effects and adverse reactions to the single-dose vaccine. This comes, though, as states across the country are reporting new outbreaks linked to kids. Last week, Wisconsin's Department of Health Services confirmed more than 700 cases in children under 18. More than 500 of those cases were in kids as young as 9 years old. CBS's Michael George tells us drug companies are pressing the U.S. government to expand emergency use of their vaccines to younger people.
Children are now in the spotlight in the coronavirus battle. Pfizer wants to extend its vaccination to those as young as 12 years old and has asked the FDA for authorization to do that. The request comes as children are believed to be central to the latest increase in cases.
There is concern about transmission in youth sports, both club sports as well as sports affiliated in schools.
In Michigan, leading the number of cases per day this week, the governor called for a 2-week pause on children's sports, along with indoor dining.
Lives depend on it. Michigan is unquestionably a national hotspot right now.
But in New York, Coney Island ceremoniously reopened.
You can't feel New York City, you can't understand New York City unless you come to Coney Island.
And amid high-profile vaccinations, this one with New Jersey's Governor Phil Murphy, there are reports of minuscule percentages of adverse reactions. Each of the 3 major vaccine producers have reported a remarkably low 0.1% of recipients had side effects. As schools aim to reopen, the CDC emphasized yesterday that its safety guidelines need to be followed.
We have not yet seen evidence of significant transmission of COVID-19 within schools when schools have fully implemented CDC's mitigation guidance.
Max Baer is going to join us now. He is a CBS News researcher, and he joins us from New York City with the facts. So I want to start with Johnson & Johnson. Vaccination sites in multiple states are pausing use of the single-dose shot after reports of adverse reactions. Many people hearing this, especially if they're scheduled for one of these shots, will likely be concerned. So, Max, what are the facts?
So, as the package kind of noted, in Georgia, North Carolina, and Colorado, 3 shots between those 3 states, 3 sites between those 3 states closed at an abundance of caution. There were less than 40 total adverse effects between the 3 sites. Symptoms ranged from dizziness, fainting, and nausea. The CDC has asked that they don't pause the use of the Johnson & Johnson vaccine, and all of the health departments that decided to temporarily close noted that these side effects were within common side effects to the vaccines. Nationwide, as the graphic kind of noted, less than 6,000 adverse effects have been reported for the J&J vaccine, and for all 3, we're looking at 0.1% of vaccinated people are reporting adverse effects. So folks should rest assured that while these sites were closed as an abundance of caution, that's health departments doing their due diligence. But the J&J vaccine, as well as the other 2 that are approved here in the U.S., are safe, and you should get your shot if you can.
It's really helpful to put that into context, Max. Thanks. So what else does the data show us about cases in children? And should parents be concerned about sending their children back to school, summer camps, other youth activities? So since kind of a lull at the beginning of March, cases in kids have increased a little bit. In the last week, March 25th to April 1st, there were more than 63,000 cases reported among kids, but that's down from more than 200,000 at the beginning of January. Kids are making up a little bit more of weekly cases. Now it's about 18%, roughly 1 in 5. When it comes to schools and youth sports, both are kind of different. The CDC has its guidelines for schools. Roughly 40% of counties are in the high transmission category, which is the highest category for CDC's reopening guidelines. They would recommend that schools, particularly middle and high schools, try and cohort students, meaning group them together to keep them 6 feet away from other people. That might mean going into a hybrid model to kind of get that done. Similarly for middle schools. But you mentioned youth sports. In Michigan yesterday, they announced that from January to March,
There were more than 290 outbreaks among youth sports, resulting in more than 1,000 positive cases. For parents, what they should consider are these sports outside or inside? And is there consistent surveillance testing happening? Those are things that they should consider. And also mask use, if you can use it in a given sport. I understand that some it might be difficult for breathing purposes, but I think those three things should be top of mind. Obviously, if the sport is outside, that certainly improves the safety of the sport.
And Max, with more adults now getting vaccinated, when do we think health officials will actually be able to start vaccination efforts for children?
So it's going to be in kind of a tiered approach. We noted that Pfizer is the latest vaccine manufacturer asking to expand its emergency use authorization to kids as young as 12. Johnson & Johnson and Moderna are also testing their vaccine in kids. So it's going to come in a phased approach. We might expect that certainly for some of the vaccines, at least by that fall school year for high schoolers and maybe some middle schoolers, they might be eligible for the vaccine, but that's not going to apply to all children. So it's not going to be kind of in one lump sum. You're going to see all adolescents qualify. But I think beginning in the fall, as Dr. Anthony Fauci has noted, that's when we might start to see particularly high schools being able to have access to the vaccine.
And when students are able to get vaccinated, obviously lately there's been a lot of discussion about vaccine passports and vaccine requirements. What is the latest about this discussion in regards to people going back to school?
That's a great question, and there may be no more hot button issue right now, given the vaccination rate, than vaccine passports. Basically, in other words, some sort of credentialing system to make sure that folks are in fact vaccinated, legitimizing that beyond just your CDC card. You've already seen more than 10 colleges and universities mandating vaccines for students coming back on campus. But this might be, even more contentious when we're talking about public schools and in K-12 schools. Again, noting that this is going to be in kind of a tiered approach, it might be difficult to mandate vaccines, especially if access across all three vaccine manufacturers isn't, the same in terms of supply for kids. So because of that lack of access, and also I should note that when it comes to vaccine passports, equity is kind of the focus on two fronts. One, how equitable is access to the vaccine? And two, how equitable is access to a vaccine passport? There is some hesitancy among health officials to kind of be full-throated and wanting to support these things. You might see some pockets of schools, test it out, especially private universities and colleges. But given the supply, it might be a difficult thing to try and mandate if access to the vaccine isn't equitable for all parents and students by the start of the fall school year.
So many considerations. All right, Max, thanks so much for joining us again.
Thank you.